Welcome to Distrust and Disparities, Dismantling Black Health Disparities podcast. We examine health disparities that disproportionately affect Black women and Black families. In addition, we amplify organizations and individuals working to dismantle racist health practices and systems to improve health outcomes for marginalized communities. I'm your host, Jasmine Moore, a registered nurse, and I'm joined by my good friend and co-host, Camille White.
Because I need people to hear that a lot of substance use provides people a sense of safety because it allows them to disconnect from the reality of this harshness in these racist systems that they cannot avoid.
In this episode, we interview Saeeda Dunston, the CEO of ELMCOR, a Black-run human justice organization addressing the public health crisis of substance use disorder and other core needs of their community. Welcome back to another episode of Distrust and Disparities podcast. This week, we want to shift our focus to the drug and opioid crisis impacting the Black community. Substance use and overdoses have always been a major crisis here in the U.S., and it has disproportionately impacted Black families and whole communities. While we were battling the COVID-19 pandemic, another crisis was happening simultaneously. Nearly 92,000 Americans died of drug overdoses in 2020, marking a 30% increase from the year before and a 75% increase over 5 years, and by far the highest annual total on record, according to the CDC. While overdose rates have increased in every major demographic group in recent years, no group has seen a bigger increase than Black men. Black men are dying approximately 4 to 5 times higher than their white counterparts. What is even more alarming is that not much attention is being paid to these alarming statistics. With drug use and overdoses at an all-time high, how do we bring more attention to the issue while learning from past efforts and mistakes to create lasting solutions? We are very excited to have a special guest here with us on the podcast to discuss why the opioid epidemic needs to be prioritized and what can be done to address it at a national level. Joining us today is Saeeda Dunston, the CEO of ELMCOR, a Black-run human justice organization that provides trauma-informed care that addresses substance use disorder as a public health crisis. And thank you for coming to the podcast. We're very excited to have you here.
Thank you for having me.
So I'm just going to jump into the questions. You have an extensive background in public health, including citywide advocacy and policy-focused coalitions that address poverty, anti-racism, and the healthcare needs of marginalized populations and communities throughout New York City. What led you to your current role at ELMCOR and your focus on substance use?
So once again, thank you for having me, Jasmine. This is a great conversation. And I just want to say it is really important that a podcast that's named Distrust and Disparities are having this conversation about substance use specifically in our community. So I just want to give credit because this is not a conversation getting a lot of attention, but one that requires it. And so as far as Saeeda goes and her history and how did she get to ELMCOR is ELMCOR itself as an organization is the name of 2 neighborhoods of East Elmhurst and Corona here in Queens. And I happen to be a girl from East Elmhurst. I'm from the neighborhood, from the community. Did a lot of my nonprofit work in Brooklyn, spend a lot of time kind of just working primarily in Black and Brown communities, very targeted and very intentionally. And so there was a gap of leadership at the organization for almost a year. And some community leaders reached out to me and said, great, you're doing all this work in Brooklyn. And when are you going to come home? I share that story because I think it's important, especially for leaders who are people of color, women of color, that we recognize that sometimes that we take away our genius from our own communities. And so a lot of what we've learned, a lot of what we gathered, we need to bring back to our spaces. And so substance use is an area of which people of color, Black people specifically, have been taken care of with or without funding, with or without regulations since the 60s, right? Probably before that, probably in the 50s. And so this is not new to us, but how we approach it's important. I did a lot of AIDS service work prior to coming to Elmcor. So my kind of interaction with substance use and with work was really from a harm reduction perspective. And so I think it was actually very helpful for me to come to an organization that was doing quote unquote traditional treatment, but never really subscribed as an organization to a lot of the harshness that happens in drug treatment programs. We have to be honest of one of the reasons why the numbers that you're talking about is happening is the access issues, is the feeling of whether or not as a Black person I will be treated the right way in any form of healthcare, of which this should be a form of healthcare. And so Elmcor never subscribed to many of the debilitating things that were happening in programs. And I work with a lot of treatment programs, and some of them are going to be pissed off that I say this. But I also say we can't correct things or get things better for human beings if we're not honest about where we're from. So Elmcor had a different approach. I came as a harm reductionist, and I think gave a different lens to this approach. And so we're lifting up the history and moving forward. So that's me. That's how I got here. That's how we deal with substance use. But I want to give credit to our community. We have been addressing it for forever. I think we need to be more vocal about it.
Yeah, and that's a great segue into our next question. How do we talk about the opioid epidemic and overdoses from a humane lens? Because I just think about in the 80s and the 90s, issues concerning drug use. It was all over the news. It was painted negatively. We focused on criminalization, and there was a lot of attention, but it was, I would say it was not productive, and it was not humane. People were labeled super predators. The whole thing surrounding crack babies and the misinformation regarding that and how they were doomed from, birth. So how do we raise the alarm now, but do it in a different way, if you get what I'm saying?
Yeah, I definitely do. Because one of the points that you made that is very, very important is as we continue to have these conversations, as we continue to raise the alarm, as you stated, that we do not fall victim to replicating the time of quote unquote the crack era, of where we started to believe that you could imprison the entire drug epidemic at the time, that somehow we were going to lock everybody up and everything was going to be okay. That actually helped exacerbate many other issues, generational wealth, HIV and AIDS, so many things, children in the foster care system, juvenile justice involved children. Like we saw all of these things that came out of this idea that we were going to lock everybody up and it was going to be okay. And so one of the things that we do when we talk about it now is also making sure when we speak about it, how we speak about it is important. And in the how is there are many of us who have gone to the point of making sure that we don't say just the opioid or the opiate epidemic, but that this is an overdose epidemic. People are having overdoses beyond just the ideas of opiates or fentanyl, which is what we're hearing a lot of. And now we're talking about xylazine. And, so there's a lot of overdose that goes on in this country, and it's not one thing. And what happens is when we concentrate on the one thing, like we did during the crack epidemic, that there are other things that are happening that we're not listening to. So I would say in our communities, one of the things and how we have the conversation is to just be honest about what is more important. Is it more important to talk about the fact that someone is using substances and we don't like it, or we feel like it's morally wrong? Or is it more important to make sure that Black men over the age of 55 who are dying at 5 times the rate of other folks, that they live? Is that more important? Is it more important that Black women who are dying at 4 times the rate of their white counterparts, that they live? Or that teenagers who we've seen an increase of 5-fold, that they live? And I think if we lead with that conversation, if we lead with the idea that we can't talk about our lives mattering in certain spaces for certain issues, we have to be concerned about our lives mattering in all spaces and in all issues. And that people who use substances are just that, people. And they're our people. And so whether they use drugs or not, the question really is, do we love our people? And if we love on our people, then we would realize that substances are something like everything else that we just need to address. We have unfortunately accepted and adopted a lot of the racist understandings of substance use in our community. We do not use substances at a higher rate than our white counterparts, but we die at a higher rate. And so the reality of it is, we need to also have the compassion and the kinder approach in our own communities as white people have had for white substance users in the last few years around the opiate epidemic, as what it was for them specifically at the time. And we need to have the same level of compassion and not allow people to come into our community now and tell us that we should be criminalized for it, that when we do it, it is morally wrong, that there is not a reason why people use substances, that there is not a physical reason that people use substances, that it is not a health issue, that it is not a mental health and wellness issue, that we make it something else. Because once we stigmatize it that way, once we accept that reality, once we've labeled it, then we're embarrassed, we're ashamed, and we stop talking. And it is nothing to be ashamed of, because I don't know but I know that if a Black man has lived in this world and has made it to 55 through all the other barriers that they've experienced, that they deserve to live a little bit longer. And so for me, that is more important than whether or not I'm unhappy the fact that he uses drugs.
You brought up some of the factors and barriers. If we truly want to address overdoses, especially in the Black community, and address it from a public health approach, we need to look at, like you were saying, some of the root causes, examine some of the social economic factors that lead people to use drugs and also sell drugs. So could you speak on some of like these social and economic factors, that, lead people to end up either using substances or selling?
Yeah, I think, I have, as an anti-racist, I have the social response, which is we have to call a thing. And we have to say that racism and systemic racism, institutional racism is in all systems that we engage in, whether it's the educational system, whether it is the criminal penal system, whether it is the banking system, whether it's the housing and real estate system, whether it is the healthcare system, that institutional racism is at the bedrock of all of it. And because of it, when we talk about socioeconomics, or as we talk about the social determinants of health, it is amazing that we don't lead with racism as a social determinant of health. Because if we lead with racism, we can talk about the lack of access to employment. We can talk about the lack of access to healthcare, the distrust, great word again, the distrust that Black people have about healthcare. We could talk about the education system and how it that if I am literally kind of designed and being placed in a position that my teachers don't see my gifts, that I am more likely to be placed in special education and not in the gifted program. I have to always tell people this. Um, Gifted programs is special ed. It just means it's outside of the form of general education, right? But when we're placed in special education, not in the gifted programs, not for the acknowledgments, and that when you start someone from that place, right? When you, at the beginning, at the genesis of someone's life, if we talk about the mortality rates of, Black women and during birthing and being able to have a maternal mortality rate that makes sense. When we talk about the beginnings starting wrong and then all the systems that people are engaged in, why are we amazed and or in shock or taken aback or clutching our pearls when a person starts using drugs? Right? Like why are we so amazed by the fact that people are either self-medicating or trying to just feel good about all the other things that's happening in the world, and then their brain starts to adjust to that need for that level of euphoria, of that sense of safety? Because I need people to hear that a lot of substance use provides people a sense of safety because it allows them to disconnect from the reality of this harshness in these racist systems that they cannot avoid, right? It's not like, oh, I'm going to just go home, right? Where is home? Is home in a safe space? Is home in, due to, institutional segregation? Am I in a safe space? Am I in a shelter because I can no longer afford my place because of gentrification? There's so much that goes into it that substance use, if we stop, should actually seem like an answer. The question is it the right answer?
Like you said, I like how you bring up, we need to say the root cause is racism at every single step. And if we take time to address some of these barriers, create opportunities for people, then hopefully that would lead to less people turning to using drugs, like you said, looking for an escape.
And that's not just for Black people when we talk about what systemic racism does, right? If, as an anti-racist, we make it very clear, it's the humanity of all human beings that are impacted by this. Racism has impacted everyone. So people that we've learned to call white are just as impacted by racism, because if you're in a system where you have to reinforce the dehumanization of another human being, it will dehumanize you. And you too will need to cope, right? You too will need to cope. And so we need to recognize that when we talk about racism as an anti-racist, we talk about substances, that we are talking about the human family. But in a racist system, Black people are designed to be at the bottom. So we are dying at higher rates. And so as a Black woman, I will continue to sound the alarm because my people are dying.
Yes. Mm-hmm. And studies show that when we work on fixing like disparities, everybody benefits. But some people, when we focus on, they call it like Black issues or Black concerns, they're like, why are they getting all this help? What about me? But people don't see everybody is affected and we all can benefit if we all address this problem together.
One of the things that we also need to do in our community as we talk about substance use is to also lean into, feel comfortable with, and not stigmatize medication-assisted treatment. That we do not shy away from the fact that methadone has historically been the gold standard for opiate use, that there is a livable life, that there is the idea of whether it's methadone or Suboxone, or really even addressing alcohol use disorder, which is still the number one disorder in regards to substance use. It is alcohol. We still, in most treatment programs, the number one use disorder will be alcohol, and that there is medication for that as well, Vivitrol, that people do not have to live without taking medication, and that we see medication for substance use disorders the same way we see diabetes medication, hypertension medication, that we recognize that this is a medication, that it is not a crutch. It is not you using drugs from some other drugs. It is none of that. It is that if I have a health condition that requires that I take a medication for me to live with this chronic condition, which means I'll have it for the rest of my life, doesn't mean that I'm a bad person, doesn't mean any of that. It means I have a health condition that requires medication. If we could destigmatize that as well, there is so much more living at the end of that. So I just want to make sure that I said that. Didn't want to miss that point.
No, that's a great point. And I'm just thinking, I think on two fronts, people need to know like their options, like reducing that shame. Like there are medications to help you with your condition, like whatever substance that you're using, that there is help to get off, that you don't have to do this alone and by yourself. And also, I'm just thinking as a provider, sometimes providers, like even in the emergency department, they're reluctant to give this medication, or there's a negative connotation associated when people like, oh, they have to take their methadone. Or I remember I had a lady and she kept stressing, like, I need my methadone. I get it. And like trying to get it from the provider and just telling them like, this is urgent. Can you put the order in? It was just like so much pushback. So I think there needs to be, like you said, some change around that as well.
Because we don't react the same way. I work with someone very closely that I love dearly who happens to have hypertension, and she's very vocal when she needs to take her blood pressure medication. She'll be like, I don't feel well, right? Like I could feel I'm off. I don't feel well. I need to make sure I took my medication, or I need to go to see my doctor if my medication's not working. And we don't judge that. Right? We don't judge that physical reaction that a person has that has a verbal response to it that just speaks up and says, hey, I'm not feeling well. I need to take my medication. But if someone is taking medication for their substance use disorder, we start saying, look at her. Look at her. Look at him. He just wants drugs. That person needs their medication because there is a physical response in your body when your body has become dependent on a substance to keep it moving. The hypertension medication is a substance. It is a drug, right? And so I think as you talk about, I hear you and I appreciate that story you shared. It's not just the stigma that exists out in the world, it's in the provider community. It is where people get health care. As providers, we want to control people and how they take their medication, and if they're a good person, if they take their medication. How wonderful would it be if the same way we say, okay, someone with a substance use disorder who's taking medication, we want to make sure that they're in counseling, right? We want to make sure that they're still getting talk therapy. I wish that we had the same belief about people who are diabetic, because I agree. If they're on medication, they need to talk about that. If you're living with a disease that could kill you, you should be in talk therapy. It doesn't matter what the condition is, but no physician will say to you, you should go to get therapy because you're going to have to live with this here diabetes. Or as my people would say, that there's sugar. No one says that you need to go talk to someone, but you do the same way. And so I think if we looked at our healthcare the same across the board, we would destigmatize health conditions of all kinds, of which this is one.
Yeah, that is very true. And before we just segue to ElmCorp and some of like the programs, was there anything else you wanted to mention that we didn't cover?
We just do a strong plug for people who are seeking treatment to seek treatment, and to not allow kind of the societal shame to stop you from, as I would say, even to go sit down for a minute. Even if you need to just have a respite. New York City is the only place, the only city that has an overdose prevention center where people can use substances safely. That we need to recognize in this city, that we do have access to that, and that people who are using substances should take advantage. And I don't know if those individuals are the people listening to this podcast, but I know everyone listening to this podcast is connected to the people who are actively using. And so my recommendation, my suggestion, my marching orders to our community is to let the people that you know who are actively using know that there's overdose prevention centers that they can use safely, because we want people to live, and that when they're ready to seek treatment, that you will be there for them, regardless of what you believe that they've done, and regardless of even what they've done to you, that you will help them get to a treatment provider.
Basically meeting people where they are. And from your harm reduction background, a lot of times we're like, why would we want people to do drugs? Like, let's just get them into treatment. But if they're actively doing drugs, why not have them go someplace where they can do it safely? And a lot of times people don't want to have that conversation. They just want to keep pushing, like, you need treatment, you need help. But if they're not ready to accept that, then how can we help to support them and reduce the shame? Even I work at an outpatient mental health program, and letting people know some of the harm reduction strategies and things like that. Sometimes people, like, they just need to stop doing it. Like, why are they doing it? But if they're doing it, how can we get them to reduce it? And say if we have somebody that is doing drugs and they go to one of these centers where they can do it safely, they're more likely to get help and to enter into recovery from those places.
Have you checked out our website? There you can find all of our episodes and show notes. You can even listen directly on the site and catch up on any previous episode you may have missed. You can read our bios and see what we're up to. Also, we made it even easier to contact us. Just fill out the form on our homepage and click submit. We invite you to recommend guests and topics we should feature. So what are you waiting for? Go check us out at distrustanddisparities.com. So Saeeda, I know in like our pre-interview sort of meeting, you discussed like a people-to-people response with the community issues that ELMCOR is addressing. And I guess, can you dive a little bit deeper into ELMCOR's sort of start and mission, and then over the many years that ELMCOR has existed, which is so wonderful, how has this center evolved and really been able to address so many community needs?
Yeah. So thanks, Camille, for that. And I get super excited. So hopefully I don't get overjoyed, even though what's wrong with overjoyed, right? About talking about ELMCOR. And we talked a little bit about like my history and how I got here, and I'm from the neighborhood. But when I started to work here, I fell in love with this organization, primarily not just because of the work that we do, but the history. And, you know, as an anti-racist, one of the major principles of anti-racism is history. And so when you can stand on pillars of a historical place, an institution, Ta-Nehisi Coates, who came to our organization during COVID, and we had a long conversation, really reminded me that to combat the idea of institutional racism, we have to preserve and adore and love on our institutions. And that he identified ELMCOR as one of those institutions. And so I start with that by saying the history of the organization. We are the oldest Black founded, Black led, and Black sustained, right? We say that because a community sustains itself. And Black sustained nonprofit in Queens. We are going to be 60 years old next year. So this organization started literally in 1965, around the same time as the assassination of Malcolm X. I say that because this neighborhood is a community that he called home. And so we feel like if you talk about the organization in 65, you could either talk about it as a organization that started during the Civil Rights Movement or the Black Power movement. We lean into the Black Power side of the movement at the time. You talked about the slogan of the organization is people for the people. It is an old slogan. It is the genesis. It is really the community members deciding that there was issues in their community they wanted to address. And so they started where most people of color start, with their children, right? Like if you're going to start something, you're going to start with the babies because we love our children, regardless of what narrative they ever tell about us. Because I do want to say, while we have this moment, that correcting narratives for our community is important to this work. And so one of the things that we correct is the love that people have for their children. Black men are more engaged in their children's lives than any other racial group, right? And that's important to say when we talk about how this started, because it was Black men and women, but primarily Black men, who said our children are suffering and we need to start something. And so Cecil Watkins, who is our founder, they actually did a street naming of him this past weekend, he was a recreation person, he worked for parks. And so it was like, let's start with recreation. And so the organization started with baseball. Now in 2024, when we think about sports and Black youth, we always start with basketball, then think about football. But baseball was literally the first all-American sport that Black people kind of broke the racial barrier, right? And so baseball was the sport that they started with. Basketball came right behind. And then there was a recognition. We can do all this recreation, but there was a lot of violence in the streets, still with young people being engaged with what was called gangs at the time. We don't really use that language. But these families that were created for protection, which is what people call gangs, were kind of set up, maybe not in the most positive ways, and people were using heroin. And so the organization got into the business, because nonprofits are still a business, and we have to be honest about that, because when we start lying to our community, they hold us accountable. And so they got into the business of substance use work, right? Before there was funding, before there was regulations. And so that was the genesis. And then they started being the first summer youth employment organization, and had preschools and had older adult centers. And that was the beginning. And so there was economic development work, there was pantries, there was all of that stuff that was sitting there. And so now, 60 years later, we have really grown. We have expanded not just our services, but our geographical reach. We are all over Queens, as far as Far Rockaway, as far as Long Island City, so beyond East Elmhurst, Corona, Jamaica areas. We've gone very far. We've done work in Harlem. We've done work in the Bronx. We now find ourselves making sure that we say we work with people as little as 3 and as old as 103. So we were able to reopen a preschool in South Queens. We have 4 older adult centers. When I came, we had 2. We're doing substance use prevention, treatment, and recovery work. We have the only youth recovery clubhouse in Queens, which means that young people can come in to this space without parental consent, whether they identify as a person in recovery, a young person in recovery, or a young person who has the ability or the possibilities of using substances at some point. So that means all young people can come into the center as a drop-in center style. We have a professional sized gymnasium for basketball. We have a boxing ring. We have a computer lab. We have a game room. We have a space, a safe space for young people, which speaks to the history. Right. We do outpatient services. We're about to open next year an integrated outpatient. So we'll be doing methadone in the site, along with the fact that we already do medication assisted treatment. We have an inpatient substance use treatment program. We have this year opened our very first supportive and affordable housing. We are providing support in the shelter system for new arrivals with the current immigration influx that we're receiving. And the housing piece, I want to highlight as for us, the thing we knew we needed to do, the business we knew we needed to be in, social determinants talk about it. That was the one that we know if you do not house human beings, everything else falls apart. And so we're happy that we're getting into that space, that we are in that space as a developer. We're very proud. Our project, we, as a Black agency, very proud of the fact that we are the developer, the management, and the service provider. We did not do that project in partnership. Not that we couldn't, but we felt it was very important for us to be able to stand up in a way that when we bring other people to the table, they recognize the power of the organization. So we do many, many things. But our easy answer to this long-winded answer that I gave is that people for the people. And so as an organization, we are responsive to what our people's needs are. So that's why we do more things. We don't believe in the adage of jack of all trades, masters of none. We believe that we'll master the needs of what we need to do for the needs of our community.
Yeah, I think that's really amazing. Like people can come to Elmcore and, they have a safe space for their children, for older adults, and get all their needs met because as we talked about, like the social economic factors, all of those are interrelated. So we can't just focus on, say just substance abuse. We need to focus on the root cause. Maybe the root cause is because you don't have a safe place to go. You don't have any supports in place. So having all those in one center, I think is amazing, and just how it evolved.
Yeah, human beings are not single issued people. We are complex. And so complex needs require complex organizations. It's just people need to be responded to in response to their needs, not in response to the organization's desires.
I guess next, because you've touched on many successes Elmcore has had, you mentioned also that you've been with Elmcore for 10 years. And that's a big deal, especially for you, because you've just never been able to do that with an organization. And you also mentioned how you fell in love with the organization. So, what's the most rewarding part of your role at Elmcore? And what gives you hope and renews your spirit to keep going?
Yeah.
So I'll start with the hope. This and it's interesting. This summer, we did an internship program with 6 young people, not a huge number, between the ages of 18 and 24. And it was really in response to kind of the need to see young people in the space absorbing the work that we do from the inside. And it gave us a lot of hope because, in the current job market, there's been some struggles, right? Post-COVID, a lot of people don't want to work in an office. We do human work. We can't be home, right? Like we need to be in the trenches. And so vacancy rates, not just for Elmcore, but across the city, across the country, in the world, the global world, is very high. Like, many people are not wanting to work outside. It'll take us a time to get over this pandemic and what it's done to us psychologically. And so having these young people in the space and the way they stepped up, and the way that they presented all what they learned, and to hear how they saw our organization, right? And these are young people that were in our girls from our softball team and boys from our basketball team, that they know they know us from that end. But like they worked in our billing department, they worked in our older adult centers, they worked in our supportive housing, and they got to see us, right? Black and brown and people of color at work excelling, and they were impressed, and they also challenged us on things that we could do better. And that gives me hope, right? It gives me hope that we are hopefully sitting here now thinking of our succession planning out for the next generation as the ones who did that for us. And so I fell in love with the history. And I tell people here all the time, we'll work here. It's a blessing for us to work here. And that someone created something that 60 years later we get to steward. And I hope that the hope is that we leave something even better for the next generation to steward. And so that's what gives me hope. My personal and professional mission statement is to inspire others. And so I feel like in this space, I have been able to do that. In a small way. And I hope that, that whole anti-racist organizing concept is to continue to organize. And so to inspire other people to organize. And I feel like this place gave me a place where I thought, and I do believe that other people were doing that without it having a label or a term. They didn't know they were anti-racist when they were building this organization. They just knew that they were doing something that was going to help people who were designed to be at the bottom. And now we have language for it. Now we've put things on it. Thank you to, your podcast and many other places. People are allowing us our voice so that we can motivate, hopefully, and inspire other spaces and other people of color to replicate the exact same thing. We try to tell people we're proud to say we're 60 years old because we want other people to know that they can do it. It is doable. It is not a myth. People of color, Black people can create sustainable things in their communities and hold on to it. And so that's what gives me hope. That's what made me fall in love. That's why I stayed somewhere longer than, as you said, Camille, I don't work no place past 5 years. I've doubled that.
Yeah, and that's amazing. And that's why we're so glad and excited to have you on this podcast just to talk about the roots of the organization. And it started from, we care about our kids. We want to do something for our kids. And then you built upon that. Like you mentioned, it can be replicated. Like you can start in your own community. You can start with addressing an issue that's close from you. Start with, the people in your household. Then, you can start with your neighborhood, but just caring about people and just, small steps. And then, like you said, it can expand and grow. So I hope people that are listening to this episode, like whatever field that you are working on, you can make some type of change. It's not hopeless, even if it's just standing up for how a doctor treats certain patients. Like taking one step can really make a difference, and just building upon that.
If you are enjoying this episode, you should consider buying us a coffee. Yes, a coffee. That small gesture will help us continue to create quality episodes and content. Click the Buy Me a Coffee link in the show notes or check out our website at distrustanddisparities.com.
Are there any other successes you want to talk about that come to mind that you haven't mentioned before?
Sure. We talked about our supportive housing, and our housing piece is a super exciting, the things that you do at night when you say, oh, I did that, right? Yeah. The housing is definitely one that I'd be like, oh, girl, you did that. There was you gotta. We have to uplift ourselves, because if we wait too long for somebody else to lift us up, we'll be living in the bottoms too long, and I ain't got no time to be in the bottoms. So one of the things that also really proud of that ELMCOR was a part of doing is during this global pandemic, we are literally located in what was deemed the epicenter of the epicenter in New York City, and the area we're in of East Elmhurst, and Corona. And our folks were dying. Before they talked about the racial disparity in the death, we know this, the statement, when white America gets a cold, Black America gets pneumonia. And so we knew, as much as we were praying it away, it was like, please don't impact us. We knew that if it came to us, we would be impacted. So we had closed our doors and sent our teams home earlier than the closures of the city, because we were already seeing people get sick, and we didn't have a name for it. We didn't, they were saying this thing, but we didn't know if that was what was going on. And so ELMCOR being ELMCOR and responding to our community, we made a decision, and of course stayed home for a short amount of time. And I think we were one of the first ones to go back in the streets, right? But we had to keep people safe first, regroup, and come back. And so we, the congresswoman from our area is AOC. right? Everyone knows her. She's super popular to everything and everyone. And because of it, has a lot of pull, hopefully, in the conversations. And this was her district that was being impacted here and the Bronx, like with the areas that were severely impacted. And she had a conversation with many executives at the time, and we were all on a call, and everyone was talking about hazard pay. And we knew that hazard pay needed to be addressed. We knew that people needed to talk about it. And of course, for us, we were like, if you're not talking about double time, no need to even start talking about hazard pay. Like, let's talk about where we start. But there was another issue that I brought up and that we brought up as an organization that, knowing my history in AIDS service work, had to be discussed. And it was the fact that people in our communities were going to die in large numbers. We were seeing it. We had one family who had lost 4 people in 1 week. The sirens in this neighborhood was constant and continuous. I had gotten to the point that I almost didn't want to answer my phone anymore because there was a call about somebody dying. It felt like every hour or every few hours. And so one of the people who worked for us, who is a brother to me, had died March 23rd. So we're talking about at the very beginning of the pandemic. And so in that conversation with our congresswoman, I talked about the need for funeral benefits, because I remember during the HIV/AIDS epidemic at the height, where people would literally leave their family members there because they didn't have the money to bury them. And the amount of people that had gotten buried in, the paupers' burial ground, and no one would even know where their people were. And we know how that level of grief is to lose someone, but imagine the grief of not being able to find someone, to not being able to continue to mourn someone in a way that is culturally connected for you. And so in that conversation, we brought it up. She worked with Senator Schumer. They pushed the legislation. And as you know, there is a funeral benefit that has impacted millions of families across the country. And we can proudly say Elmcor started that conversation. And so one of those other ones that we could say, hey, we did that. But we did it in response again. And I think I keep saying that word response because we have to be responsive to our people. When people are in pain, we have to act. We can no longer continue to talk. We have to utilize spaces like these podcasts where we have conversations to understand that these are calls to action, that we are not just talking to hear ourselves speak, but that we are speaking to you to speak through you. And so that is one of the ones that we're really proud of, because if we didn't speak up, then what?
Yeah, that is amazing. And like you said, it's not only affecting the community surrounding Elmcor, it's affecting everyone nationally can benefit from having these funeral benefits and things like that. And I would say, speaking of policy change, and have you been in talks with bringing Elmcor's model to other communities or supporting other small community centers on expansion?
Yeah. So a part of our strategic goal as well within our organization is to help the replication of it. We've worked with another nonprofit run by folks of color who have done a really great job also of saving other nonprofits that look like them so that they don't close. And so that's one of the things that we also want to work on, is also not just providing technical assistance, but also if there are organizations that we could come in and make them an affiliate of the organization, so we could continue to not just grow the Elmcor model, but to sustain. That's the reason why I use that word, organizations that may just need the help. And for us to also not see it as, oh, someone's taking us over, but to understanding that organizing means I don't let you die. And that I will do whatever it needs to do to get you there, and for us to all benefit from the infrastructure that this place has done. So yes, we are working towards replication. We want to help people. We want to do technical assistance. And we also want to be able to create affiliates of nonprofits who may be struggling, who do not want to close their doors, that if we are in a position to help and sustain and move forward, that we would do so.
Yeah, I think that's great, being able to help to sustain people to make their work a little bit easier. And I was just thinking of what you said earlier, focusing on the community. Do I love my people? Do I want to help them? So what do you have to do to help your people? Asking for help, being able to receive that help, instead of thinking of, oh, somebody's taking us over. But this is helping us to continue to do the work and maybe be able to reach more people.
You've addressed so many things, and we're so grateful for you to have come on and talk about all of your amazing work and your background in MCOR. And given the work that you're in this space, we want to close it out in terms of a personal question. How do you take care of yourself so that you can continue to do this work? And what do you do in your own, say, personal life to bring you joy and have fun? Because you really need to replenish yourself when you are in a space like this. And that is helpful, where we want to share that with our audience of people who want to do this work, where it's also, you can't get burnt out. You got to be able to replenish yourself and really take care of yourself. So what are some things that you do?
That's a great question. And typically the toughest question, especially for folks who work at the speed I work at. I move at a particular speed it's exhilarating, but it can also be degenerative as well. It does have the ability to burn at all ends. I can't say, I wish I could. I want to be that person who says, I meditate, I do yoga, I drink tea. Because every time I see people talk like that, I'm like, oh, it sounds so airy and fun and light. And I'm like, that's not me. That's just not. I want to say it. I swear, ladies, I do. I want to be like, ooh, I sit and I meditate. I'm like, if you sit me down too long, I'm thinking about a whole bunch of other stuff. It doesn't work for me.
Yeah.
So my answer to that, and what do? I laugh. I love humor. I have no problem knowing that I'm a very smart woman who can watch trashy TV. I'm comfortable with the concept of laughing about things that are probably not the most appropriate, but I think that they're hilarious. And so humor is really what sustains me. So my husband is one of the funniest human beings I've ever been around. My dad, I think, is hilarious. My children, unfortunately, had to become funny, because you can't survive in my family or you'll be the butt of the joke. So you better figure out how to make a joke. But I say all of that because what keeps me going and what gives me life is humor and my family and my friends. I am able to constantly live the statement that I laugh to stop myself from crying, because doing this type of work, loving on your people, knowing that your people are under siege, recognizing that we're always almost at war for our communities, it is something to cry about. And we shouldn't be ashamed to say that. It is something to be angry about, and we shouldn't be ashamed to say that either. And I still want to laugh, though. I still want to be able to have joy. Joy was my mom's name, and I think it's something I live by. And so for me, joy is in being able to laugh, make jokes, and to be with my family and friends, laughing and making jokes. I don't want to be around them just feeling like the weight of the world sits in our space. So we all kind of laugh to stop ourselves from crying, because it's a good cry when you're doing this work.
Thanks for listening to this week's episode. Do you have recommendations for topics we should discuss about health disparities or injustices? Guests we should interview doing amazing health justice work? Or organizations we should highlight creating positive change for marginalized communities? Please visit us at distrustanddisparities.com or email us at distrustanddisparities@gmail.com. Remember to subscribe, rate, and review us wherever you listen to podcasts. And follow us on Instagram, Facebook, Twitter, YouTube, and LinkedIn.